everyone. My name is Ellen Hicks, and I would like to welcome you all here today um, as part of our final series of the Deep Brain Stimulation. I am the care navigator here at the Parkinson Association of Alabama. So before we begin, I'm going to go over a few little housekeeping things, and then I will introduce our speaker for today. This is being recorded, so you will receive an email following this in the next couple days, so you can rewatch and learn
Keep sliding
again.
down this chair.
And then also, if you have any questions, you feel free to use the chat option at the bottom of your screen. And you can also there's a hand there that you can raise your hand and we will call on you and get your questions answered. Um, so today we are honored to have Mr. Gary Thompson. He is a proud veteran of the U.S. Marine Corps. He joined the military at the age of 19 and was deployed to Vietnam at 20. He returned home and pursued his higher education and graduated with honors. He worked a long, fulfilling career and retired around 7 years ago. He began
Longer than that.
longer,
I retired in 2006.
2006. Okay, I'm sorry.
Yeah.
Almost 20 years ago.
Yeah.
Okay, well, there you have it. So, and he not began, but he enjoyed playing golf and sitting on his back patio after a nice game. And that's kind of when he began to notice the first signs of Parkinson's disease around 5 years ago.
Yeah. Or so, like that. I
Okay,
don't know. You look down at your hand moving and you don't record the date. You go, what the hell's going on?
that's right. So,
And I used to could look at my hand and think about it and make it stop. And then it got where I couldn't.
yeah.
And that's where we went from there to I went to my old doctor and he told me, he said, "Oh, Gary, you ain't got Parkinson's. You just got a tremor." And I said, "Okay." Well, and I went down to the courthouse and filed through uh, the court or the group down there. She was retired Navy and she filed for Parkinsonism and that didn't go anywhere. And finally, when my left side got so bad, uh, I went to a VA clinic up off of Drake Avenue, I think it is in Huntsville. Beautiful, brand new clinic. Everybody was super nice. And I met with this doctor, and she immediately, after about 30 minutes with her, she immediately said, "You need to go to Birmingham, and I will make the appointment for you." So ended up at Birmingham, and I think it was the second trip I met Dr. Sohn. Uh, and that was, of course, that was during COVID. I didn't know what he looked like for a long time. I was down there. I said, "Pull that mask off. Let me see you." Well, I mean, you did. And he started, and he put me on the whatever pills I took 3 times a day, half pill 3 times a day. Did not work. Made me feel like crap. So went from there to he started talking about DBS. And I told Shawnee, my wife, I said, "Shawnee, they ain't drilling a hole in my head at VA. I promise you that." So finally he come to me and said, "Do you have private insurance?" And I said, "Yes, I do. I've got Medicare plus Blue Cross Blue Shield C plus." And he said, "Well, good." He said, "You wouldn't mind having this at UAB versus VA?" I said, "Hell no. I'd rather." So that's how I ended up with Mike and Dr. Holland, and he made the recommendation. We went down. He showed me and Dr. Holland's a really, really nice doctor. Young, energetic, and a lot of fun, to be around. But he showed me the little probe. You put the penny down beside it and took a picture of it. Right. I'm telling you how many people I've shown that to. And the worst part, I told Mike a while ago, the worst part, I guess maybe I blocked it out from the first surgery, or maybe it wasn't as bad. The bit was dull or what, I don't know. But the drilling of the hole in your head is the worst part. After you get past that, nothing to it. I carried on a conversation with Mike the whole time for 2 hours after that, or three, or it don't take me long to drill a hole. Then oh, we're gonna listen to you. I ain't figured out what they were doing listening to my brain, but maybe they do.
Yeah, so it's normal for Ellen, it's normal for a patient undergoing deep brain stimulation on the first side to sort of forget what they went through during the first surgery. Most people report that the numbing of the scalp is the worst part, but sometimes we have folks that come back for the second side, and when we have to make the access hole in the skull, we can go in on a spot in the skull that's kind of sensitive, and it's about, it's probably about 1 out of 10 people experience that. But I think what's interesting about Mr. Thompson is that he had his first side done, and the results, were good.
Absolutely perfect.
And then did you have any hesitation about having the second side
None
done?
whatsoever.
Okay.
I mean, the right side has really got bad, and I'm right-handed, so heck, I love to play games on the computer, Sudoku and stuff. Hell, I couldn't even play that because I couldn't hold the mouse to click. I mean, I clicked, but I missed.
Right. And what other symptoms did you have? So you had the tremor, but what else
I
did
was
you
starting to lose. I lost taste of smell 4 or 5 years ago, a long time ago, and the taste of just taste.
Right.
And Shawnee really likes to cook. Like the other day, she got mad at me, but I just told her the truth. She said, well, what do you want for lunch? I said, it don't matter. She said, why? I said, it all tastes the same. So you just cook what you want and I'll eat it. Heck, I'm the easiest person in the world to cook for.
Right. Well, tell us a little bit about so let's go back to the first side, and you went through the surgery,
Watched it.
and you watched your own surgery,
Twice.
with the video camera, that we have in the operating room. Patients are given the option to watch their own procedure. What was it like to watch that procedure?
The first time it was weird. I mean, you don't know what they're doing. You don't know. And the second time, I knew exactly what was going on.
Right.
And I remember that we talked the whole time. I go, what? And I remember I had to remind Dr. Holland, this side is different from that side. If you can see, there's a little bump on this side right here. And I'll jokingly every time both surgeries, I said, all right, boys, here are the rules. Nobody says oops or uh-oh. You're messing with my brain. So no oopses or uh-ohs or ah shits. It just so he got ready to move the device and everything mounted to and stripped a screw in it. And I said, after the third time I felt the screwdriver slip, I said, did you strip that screw? He said, yeah. He said, but and the key word is, oh, we got that. We got a problem. We got a solution for that. And they wiggled the screw enough that it snapped off. And he ground the screw down flush on my head. So I had to remind him, of that.
So
I like to have fun and cut up, and I did during the whole surgery.
Yeah, you were fun during your surgery. I mean, it's interesting because the surgery is obviously a real serious thing. But when patients go into surgery at a DBS center that has a lot of experience, the whole staff is there and they feed off of the patient. So if the patient is a jovial sort, they'll work with that just to keep their minds off of worrying and all of that. But we also have folks who are real serious folks, or they're terrified. And the thing is that we're going to have somebody there, holding your hand, talking to you during that case.
The kid that did monitor my signs and all that said at the foot.
Yeah.
After they all stitched up and I was waiting in there to go to recovery, I guess it was. He said, I was watching you when I was drilling that hole. He said, we had to have you strapped down. He was leaving. He said, we couldn't have held you. Because once they start drilling, it is
it's loud.
Extremely loud. You go, God, no, I don't remember this.
So we have a question about that.
Oh, here we go.
Sorry, somebody asked Do you get anything for the anxiety about drilling a hole and remaining still?
Do you get any medicine?
I
I
think
guess
it's
is the
No,
either,
question.
it may be both. They may be asking, did you get medicine? And then maybe, do you still have anxiety about it?
So Gary, you can
hey,
answer
well,
that.
I don't remember getting anything. They told me I had to be wide awake, so.
Some patients will, so if they pick up on the patient uh, really struggling with anxiety, sometimes drugs can be administered. One of them is called Precedex, to help calm you down and just take the edge off of the emotional stress that you might be having. Every center does it differently. But the preference in Birmingham is that the patient be as awake as possible, because we get our information in the surgery from the imaging that we have, so the radiological imaging, from the listening to the brain that we do, that Mr. Thompson just referenced. And then finally, the most important indicator of the success of the DBS, or indicator of side effects, is what the patient communicates to us. And
I
and so
remember in the
we
first
manage
surgery.
that stress.
Yeah, I remember in the first surgery, Dr. McCullough.
Yeah.
Is that right? He looked at you and said, well, I think we've hit a home run. And I said, yeah.
That's right.
Yeah.
Yeah. So he was asking the medicine, and you're saying you can't, sometimes they will give you something for the anxiety during the surgery to kind of take the edge off.
Correct.
Okay.
That's correct.
Indeed. And I would highly recommend watching it.
Yeah. And then
Well,
you are not supposed to take your Parkinson's medications that day, correct?
I don't take any Parkinson's medication. I couldn't handle them, and we stopped taking them years ago, a couple of years ago.
Yeah, that's not unusual at all. We see it, but a normal, in a normal circumstance, the patient is asked to stop taking medicines the night before. That way, it's tough on the patient, but that way, again, that patient being a key part of the process, we can ensure that we are seeing them at their worst, so that we know exactly what we're helping them with. And so hopefully that answers that question.
It does. And real quick before you keep going, you said you had Medicare. Did Medicare cover it?
I've never paid a penny. All I know is, I don't know, I got a letter after the first surgery, a couple of months later, said, Medicare refused to pay that, but don't worry, we got it covered. So I assume the VA picked up their part of it. I do not know. Said, don't worry about it, we will never contact you again. I said, good.
Yeah, and Ellen, just from my experience, Blue Cross Blue Shield, all the major insurance carriers cover DBS.
Yeah.
And where there's a little bit of difference between patients is the type of coverage. So Medicare definitely covers DBS. But if you have Medicare Advantage or some of these other programs, you might have a copay. It's typically not prohibitive, but your physician, there'll be a financial counselor that's involved in the process that can manage your expectations around that.
I would recommend C plus, because I'd never had a surgery in my life, never been put to sleep. I had my knee scoped, I don't know, after about 72, when I was 72 or 73. I've never paid, I don't pay for a doctor's office, I don't pay for anything.
That's fantastic. Part of that's probably your veterans benefits as well.
I don't know. But I won't talk about the VA.
Yeah, I understand. So the next phase of your journey, so you had your surgery, and then we turned your system on a little bit on the day of your battery placement, and then you came
1.5.
1.5. Did you experience any benefit from that?
I think first surgery, yes. Second surgery, no.
Okay, all right.
And it didn't calm this tremor down until I went back.
Right,
That's the reason I'm trying to get back in such a hurry after 3 weeks and it was 5.
right. So can you walk us through what it was like on the day that you had your first programming session for your first side?
I really didn't know what to expect. I went in there and they put this collar around you and it covers the batteries, and then they're in control and it was just wow. Immediately when they stopped the tremor, it was just, I couldn't believe it. Everybody, I belong to a country club here and live on First Tee, and I go up to eat and do all things. I'm not playing golf right now. I hope to get back to it, but I go up, "Hey, Gary had surgery," and I stick up my left hand and it would be just steady as a rock, and everybody knew me and said, "Oh my God, Gary, look at that." Got one old guy that's nearly 90 and he says, "It is unreal."
So I mean, you have a community of people here that are probably pretty vocal in insofar as observing how you've done before and after. It's interesting because we do from time to time run across people who play golf and their buddies do start to complain about your newfound ability to swing the club, and they ask you to change your handicap.
Yeah.
So
Not me.
are there any questions out there, Ellen, right now?
Not right now.
Okay, so what I thought I would do is, if it's okay with you, is show you something. This is something that we didn't get to see in the DBS, in the DBS segment last week. Yes, sir.
All right.
I'm going to do right chest. So what you see here is you see the patient controller for the deep brain stimulator. This is for the deep brain stimulator that's in Mr. Thompson's right chest that controls his left side. And what these tools do, and I'll show you the command module here. So this device is an Android phone that's been programmed to control deep brain stimulator. And then this is a communicator. What this does is it takes a Bluetooth signal and essentially encrypts that signal so that we're not talking to Mr. Thompson's system in Bluetooth. And different manufacturers have different patient interfaces, but this one allows him to check the status of his battery. Right now, his battery is shown to last more than 5 years. I don't know if you can see that, but he can check how long his battery is going to last in years, which is a nice feature. And then the other thing that he can do is he can turn his therapy up and down. And this allows him to change the therapy on his new side that we've done. We're still in the process of fine tuning that. And he's using this feature right now to help him because he's having a little bit of a speech side effect. And when we lower the stimulation, his speech gets better, but his tremor comes out. And that's just because he's only had his first programming session on his new side. But I'm going to operate his old side. And
let me get ready.
Yeah, so I'm going to, I'm just using his
patient. I'm going to hold my hand like this.
Yep. So I'm going to use his patient controller, and I'm just going to go down on the stimulation. And in fact, I'm just going to actually
turn it
off because I think that's the most expeditious way of doing this. Right. So we're turning it off. It takes a second, but you'll know when it's off. So I just turned his therapy off. You'll see a big thing that says therapy off here.
And there's my left hand.
And there's the tremor coming back. And then, Gary, can you do your hand like this?
Yep.
Okay. So you see how his hand is moving kind of slow, and then do finger taps?
I'm real fast. I'm on them.
And it looks, so you see his tremor more than anything. And now I'm going to turn it back on. So I want y'all to watch me. I'm just going to click this button here. And his therapy is going to turn back on.
At the same time.
And now hold your hand. It's going to be right back to where we had it. And you're going to see his tremor calm down.
Go away. Look at that.
And
Wow.
so right there, you're seeing,
Yeah.
the difference between the deep brain stimulator being turned on and off. And we're doing this with the patient's controller. So a lot of people have questions. They wonder, do I have any control of this thing when I get home? You have as much control of it as you're willing to take on, except that the doctor's programmer allows the doctors to change some parameters that are more complicated. But when a patient goes home with a deep brain stimulator, they do have the ability to turn their device on or off, check how many years their battery is going to last. And that is just another way that we can help customize the therapy to the patient.
Matter of fact, the first adjustment we made to the left side, you were driving down I-65, going to Huntsville Hospital and talked us through it
Yeah,
on the telephone. My wife, she always goes, I'm gonna turn you off. I said, please don't.
yeah. Sometimes we'll have spouses that they
Threaten.
they use that programmer to make them act right. But
Oh, she wouldn't do it.
yeah, in all seriousness. So now we're on the left chest, and I'm going to turn the stimulator up a little bit and show everybody what a speech side effect might look like. So show us that right hand and hold it out. Okay.
Well, you didn't switch sides on me.
Yes, I switched sides on you, and you'll see his tremor's just about gone here. But now, Gary, I'm going to get Gary to repeat a phrase that we use to tell whether or not somebody has some speech impact from the DBS. So, can you say, "I went to the store and I forgot my wallet"?
I went to the store and I forgot my wallet.
So, if you notice, his speech has gotten slightly slurred. Now, if we go back down and leave that hand up there, Mr. Thompson.
Let's go to that, about 2.25.
2.25. So
Yeah.
I'm going down and see, he knows his system better than me now.
Because if everything works right, my speech will get better and I'll show a slight tremor. And I have not been playing with it, I promise.
Yeah, we tell people you don't want to play too much with it. I'm actually going down to 2.
All right.
So now hold that arm out.
It's doing good.
So right now he doesn't have a lot of tremor, but it's starting to come back in the finger. Now say I went to the store and I forgot my wallet.
I went to the store and I forgot my wallet.
So very crisp and clean.
Yeah.
So the reason that I thought Mr. Thompson would be a helpful guest on this series is that he's a good example of someone who is almost done with the fine tuning. And all we have to do now is probably see him, 1, maybe 2 more times in clinic to get everything just right where we want it. What did you have this on for?
2.5. I think most of them are on 2.5.
Okay.
But leave it down.
Okay.
Yeah, we're doing good. Let's
Okay.
leave it at
All right. And I'll do what
2.25.
I've got it at 2.25. But
all right.
that is so that change that you might have noticed in the speech is very subtle, but that is a side effect of DBS, and it's something that we can typically program around. Not always. When we put brain stimulators on both sides of the head, we can cause speech issues.
Yeah, and balance.
And balance issues. That's right. And so these are things that we manage that expectation with the patient to let them know what to expect. And then we bring them in and we program the DBS over multiple sessions to optimize things. And that DBS is firing away in a Parkinson's patient 24 hours a day, 7 days a week.
Yep.
And it's interesting. Mr. Thompson doesn't take Parkinson's medicines. So that's not your typical scenario.
The only thing I've taken is that new prescription
for restless leg syndrome. Right. So, but that, that's a good summary of how DBS works. I don't know if there's any other questions from the group.
Now, one thing I will mention, I've told my wife 2 or 3 times, I got a first cousin, he needs hearing aids bad, but he won't buy them. But anyway, he was down here, we were watching Auburn, the Elite 8, and he kept saying, Gary, gotta speak up. I said, this is my voice. I said, you either buy some damn hearing aids or it's either this or I have to yell.
Right.
One of the two. as he chose to, I don't know if he's gonna buy hearing aids or not, but we'll find out. We're going fishing next week, so.
And one of the things that Parkinson's does cause is something called hypophonia. And hypophonia, it just means low speaking. So Parkinson's patients already can have a low volume of speech, but DBS can actually affect the ability for patients to or to articulate words because we can cause some tightening of the muscles in the face and around the throat if we are producing a side effect.
What did that girl do when I saw two doorknobs?
So that's during the programming session, this is very programming. I tell people when they come in for initial programming that it will probably be one of the weirdest days of their life. And
Absolutely.
where the DBS wire goes in the brain, sometimes we can activate a nerve in the brain that has to do with your muscles around your eyeballs. And as part of the process of programming, we can give you double vision. It's temporary. We see it and we turn the stimulator down and move to another spot. But
That's the weirdest thing I ever saw.
yeah,
I was standing there on the table looking at the doorknob, and all of a sudden there was two of them. I went, "Whoa, whatever you did, let's undo it." You know, I started.
and that's the thing about DBS is that we can undo these things. It's but part of the process of programming a deep brain stimulator is that you do try each contact that we have available on the array. It looks like you had a question pop up, Ellen.
Yes. It says, does it help with restless legs?
Best I can tell, no, because I've just started this about since the surgery, probably.
Yeah, it's
But
not.
I cramp. I get a cramp in my left foot every night, and I don't know if it's any better or not since I only been taking it for about a week.
Right. So, yeah, unfortunately, we can't make the claim that this helps with restless leg syndrome. I know that's a terrible thing to have. But the DBS, I always remind people it's for tremor, stiffness, and slowness. And some of these other things that come along with Parkinson's, non-motor symptoms, things like that, we just can't make that claim that DBS is going to help.
But the quality of life is such an improvement. You saw my left hand a while ago. I mean, what kind of life can you have when both of them would have been that bad? You can't have quality of life. This does it for me. I mean, yeah, I'm planning on wearing out a couple of batteries. So,
And that's the other thing I'll mention, Ellen, is that so people have different implantation techniques, but he has a battery.
I mean, I can show it to you.
You can show them this one right here if you want to.
Yeah.
Whichever one is easier.
You can barely see the scar now.
Yeah, the scar is barely there, but there's a battery pack under here.
Right.
And last week I showed that there were different types of batteries. You have rechargeable batteries, and then you have primary cell batteries. Mr. Thompson has two primary cell batteries, and the one on the right, we mentioned earlier that the one on the left had quite a few years on it. The one on the right has more than 6 years of life left on it. We can read it here on the programmer. And when that battery is changed, that surgery is nothing like the actual brain surgery or the initial placement of the battery. We simply would go in here, make an incision where the scar is, pop this module out, put a new one in. It looks like you might have another question pop up.
Yep. Well, we have a bunch. I'm going to ask,
Okay.
how does it feel to have the device implanted? Do you notice it on a day-to-day, daily activities?
The only thing is this battery was moved a little left, and I figured it was because it was over my heart, because you got this one. But that was the only issue I had. It was a little sore than this one because you can feel it a little bit more. It's a little more to the left.
Okay.
But other than that, you don't even know it's there.
Some people that are side sleepers will notice it. And then some people who wear glasses, there's a wire that runs from here back to here.
Right there.
And we try to keep that wire away from where your glasses would go over your ears. But if you do wear glasses, you just need to tell your surgeon to make sure they tuck that wire further behind the ear so that it doesn't irritate you when you're wearing glasses.
Oh, and I found out something during the surgery. I said, all right, you got all these wires. He's over there making a pocket and he's stuffing that wire in. I said, why the hell don't you just leave it outside? He said, because it will pick up bacteria.
Yeah.
And he said, if it's under the skin sealed, he said it will not pick up bacteria. So, I mean, I was full of, and they didn't do anything this last time, and I didn't question or ask. I even got to watch him sight it in where you get talking about Kentucky
Right.
windage, and the kid was from Athens. I talked to him about that.
Yeah.
Just north of here. We just had a nice conversation. I watched him sight it in. He'd adjust it and he'd drift off and he'd adjust it again and he'd adjust it a little farther. And when he finally settled, he had it dead center.
Yeah, and he's talking about the targeting mechanism that we use at UAB
to place the probe, right?
To place the probe. It's a frameless apparatus. So it sounds like we have quite a few questions.
Yep. Okay, the next one. Is it normal to not take PD meds after surgery?
No. So I would say that Mr. Thompson is an outlier in that he has been he doesn't take any Parkinson's medicines. Most patients still have to take some medicines even after the DBS.
Okay.
I wouldn't mind taking anything if I knew it would help, but I don't think they know that it will do anything.
Okay. Is there a benefit to waiting as long as possible for from a technology development standpoint? Sorry.
Yeah. So I will tell you that right now, and I can't speak for other manufacturers, but right now, Medtronic just launched adaptive DBS. We've been doing it a long time. I think that no matter the manufacturer you choose, DBS is in a posture where most of the improvements that are coming are software updates, not necessarily hardware updates. Although I'm sure that there are some hardware updates that are going on out there. Waiting for the technology to be perfected is going to just prolong, your symptoms. But what I would encourage you to do, like I talked on the last call, talk to an informed movement disorders neurologist if you can, and they'll give you their appraisal of where the technology is, and whether or not they think you ought to wait. It's a very personal decision. It's also something that you need to wade into with the advice of an expert.
Little humorous side, while we were doing that, we were discussing a friend of mine, Mike, and he may not remember this, but I remember it quite adamantly. But he said, I was telling him about this friend of mine that had shoulder surgery, went out walking in the 15-degree weather, slipped, fell on his shoulder he had surgery with. And I told him I'd been calling him dumbass for the last month. And he called me today and said, I'm through with therapy. I said, well, what are you going to do next? But anyway, and Mike said, he's a dumbass. You volunteered twice, let's drill a hole in your head.
That's right. That's what I like about Mr. Thompson. He doesn't hold back and he cuts up with us. But yeah, go ahead, Ellen. I know you have more. I know you have more questions.
Are there any activities that you can do now that were difficult before your surgery?
Oh, I can do everything except I can't. This balance problem it's come up with this second one. I mean, I was hitting the ball okay. I was just before it was just I'd already switched to a long putter a long time ago because of handshaking. And it got to where I could not putt because the left hand, and it finally got to where I couldn't putt because of my right hand shaking. So I only played 6 times last year, but the balance problem is an issue with golf. That's the only issue. I told Mike earlier, I'm sitting in my recliner in there watching TV. I'm as normal as I can be. No tremors, no anything. As soon as I stand up, then the world kind of gets wobbly.
And that's where, we're working on this new side, Ellen, and we're trying to fine tune the stimulation. And that balance is a side effect that that we will move away from once we move to another contact and refine our stimulation field.
And Mr. Thompson, I don't want to speak for you, but I think that when we were speaking the other day, you were telling me that you had a hard time eating, that you wouldn't really go out in public to go eat places because
Yeah,
of your
well, it
tremor.
got embarrassing, everybody's got their pride and nobody wants to go out and people be staring at you because your hand's shaking so bad you can't put food in your mouth. And my doctor, which I really liked, said he had his father or uncle one, said if he went out to eat, he carried these things real heavy, fork and spoon. And when things were really bad, I could not eat with a plastic spoon. It was just too light and God, I'd throw food everywhere.
So did y'all have an occasion to go out after you got the
Yeah, we
DBS?
didn't back to normal life.
Okay.
Yeah.
All right.
If I get nervous, like during Auburn basketball, hell, I'll get tremors again, but it ain't got nothing to do with the DBS.
Yeah, we get that question a lot. We'll ask people will say, Mike, I've had my tremor return, or I've had some symptom return. And once we start going down the list of questions, stress, good or bad stress. So a wedding, going to a happy wedding, or watching your favorite basketball team, barely get by in a game. That's all different sorts of stress, and they can make symptoms of Parkinson's disease worse.
Yeah, I can promise you that. Well, I tremored a lot during the basketball season this year, but we're going to the Final Four.
That's right. I'm good, Ms. Thompson. Thank you. So, are there any more questions, Alan?
I'm not seeing any right now, but that
Okay.
doesn't mean, does anybody have any more questions for Mr. Thompson or Mike? So, Mr. Thompson, how long did it take before you started to notice the changes after your surgery?
Well, they make you wait 3 weeks before they put you on a 1.5 setting and then make you wait 3 weeks. And on the first one, after the initial setting, we made one adjustment. And that was it. Been right there ever since. At 2.5 millivolts, I think it's millivolts. But the other side is a different ball game. And I know you're dealing with two probes and I don't know what all, but all I know is it has not been as smooth as number one.
Mike, is that common for one side to be on a different setting than the other?
It is. I mean, if you think about maybe your feet, it's a real common example. People will have one foot that's bigger than the other. In the brain, one thing that you deal with is that the anatomy on one side of the brain is slightly different than the anatomy on the other side of the brain. And secondarily, each placement of the deep brain stimulator lead or probe is unique. So we don't try to mirror our placements or anything like that. We're actually going for a customized placement of that lead. So what that means is that the settings are going to be different on each side. And then also both sides of the brain, when they're stimulated, you can get some cross interaction as well. And so that often makes it so that the second side programming can be a little bit more challenging. Now, there's some institutions that do both sides at once. That prolongs the programming time sometimes, but it's not unusual for someone to have a really good side and the other side be comparably. I don't want to use the word worse, but you'll have one side that's just done fantastic and the other side may do just as well, but sometimes you'll see that the other side takes a little bit longer to optimize. And you're also dealing with progression of Parkinson's along with that. So, one thing that I really encourage anybody, whether you have a deep brain stimulator or not, I encourage anybody to know that we have a really large arsenal of tools to deal with the deep brain stimulator. And if you're seeing if you're seeing a Parkinson's specialist, they can use those different levers to help optimize you, but sometimes to chase perfection can really be frustrating. So I just try to encourage people that perfection might not always be attainable, but we can do a lot better than baseline with most people, whether they're getting DBS or not.
Yeah. If we get this balance problem issued, I'm back to normal, or as normal as I get.
So this is another question, and Mike, this might be more up your alley. I had DBS surgery in September of 2019. I have a controller that is not Bluetooth enabled. It's from Medtronic. I had to have the battery replaced in 2002, and I'm scheduled for another replacement on the 25th of this month. My experience is that the battery replacement is a significant event. Is it common that batteries last for only 2 years?
So battery drain is something we all deal with if you have a primary cell battery, like Mr. Thompson has here. And battery drain in 2 years indicates to me that the settings on that deep brain stimulator are high. The settings are high because, as I explained, every deep brain stimulator lead is a custom placement for a patient's specific anatomy. And sometimes you need higher settings. That can mean higher amplitude, or it can mean it's firing faster per second, or each firing burst is longer. That's what drives the power down. But my recommendation would be to, one thing that's very simple to do if your battery's lasting 2 years is that you could request that the dual channel battery be used, unless that's already what they're using. If not, you could also talk about rechargeable technology with your neurosurgeon.
Be like your phone, you just lay something on it.
Yeah, you can put a pad over it.
Yeah, wow.
That's another option that's out there. But we have a lot more flexibility than we used to have, because we're sitting on 4 generations of batteries, at least at Medtronic, and our original batteries that we implanted the most, at least in Birmingham, they lasted around 34 to 36 months. But now we have systems that when they're hooked to one wire, they can last, like Mr. Thompson has a battery here that's going to last 6 years, and he doesn't have small settings at all. So I'm sorry for the long-winded answer, but because every deep brain stimulation patient has an implant in a different that's been personally, customly placed, it's hard to know whether your battery is going to last 3 years or 1 year, especially if you have really high use demands. So, and they're welcome to call me. It's a Medtronic patient. They can call me at 205-306-4019, and I can happily talk them through in greater detail what I'm talking about.
Okay, and I can put your number in the chat too, in case somebody missed it. You're gonna be getting all sorts of calls.
That's okay.
He's good about answering. He does better if you text him, though.
I say that on my voicemail too.
Yeah.
Yeah, I'm happy to take calls from people that have questions. That's a big part of my job that I take seriously.
Okay, well, anybody else has any more questions, we can answer them, and then we can wrap up here in a few minutes. I guess, Mr. Thompson, what would be your advice to somebody considering DBS?
Do it. I mean, seriously. I mean, that's not a bad do it or don't do it or whatever, but it is. If you're looking for a better quality of life, I'm 75, soon be 76, and I know I'm on the short end of the stick here, but hey, I want to have a quality of life, and you saw that trimmer right a while ago when he turned that thing off. What kind of quality of life can you have if your body's shaking like that? You cannot. So just for the issue of quality of life, I would do it.
Great. Well, I think that if no one else has any more questions, we can end a few minutes early. We thank you, Mr.
Oh, you're
Thompson
welcome.
and Mike Tapley. Thank you so much, both of you, for your time. And thank everyone for joining us today. Um, if we don't have any more questions, I think that we can wrap up.
All right.
And
I was glad to do this. I'm really serious about that. I mean, it's if I can do anything to help anyone, they can call me or get in touch with Mike. He can put you in touch with me. I'll talk you through it. But I would recommend, I mean, for me personally, watching the surgery is much better than not knowing what they're doing up there.